Welcome back, everybody, to On the Couch. Thank you for returning. And those of you that have been following me so far, please subscribe on YouTube. So I just wanted to remind you, and follow me on Facebook. Okay, tonight we're going to get into another topic. Of course, surrounded around mental health today. We're going to be talking about depression and suicide. Why are we talking about that topic today? Well, let's talk about how it affects our community, the Black and Brown community. So I want to provide you for some psychoeducation on these two topics. So let's get ready to start with depression. So what is depression? Okay, so everybody has the blues sometime. Some people are sad, but here's where the problem comes in. When it becomes excessive sadness, excessive feeling like you're stuck in the blues and pretty much like the dark, where it surpasses more than a few days. So if that is happening and it's interfering with your daily life, and you're also accepting the fact that these excessive depressive feelings become normal for you, then that's a concern. That is a form and a sign of depression. So what are the different type of depressions? Major depressive disorder. So major depressive disorder is a combination of symptoms that interfere with a person's ability to work, sleep, and study. So what happens with this and how does this come about? An episode of major depression occurs one time in a person's lifetime. One time. However, major depression, again, are symptoms that interfere with a person's ability to work, sleep, study, and other things of pleasure. Dysthymic disorder. This is a long-term depression, but less severe in symptoms. So here are some dysthymic disorders. Psychotic depression. What is that? So this is severe depression illness is accompanied by some form of psychosis, such as break with reality, hallucinations, and delusions. Now here's the thing. We've always talked about that uncle or that aunt, possibly the grandmother or the cousin, someone who's possibly psychotic, but we're not realizing that they're possibly going through psychotic depression. So pushing them to the side is not the best answer. The best way to handle that is by getting them help that they need. So this is our job. When we see that, it's not all about maybe the substances that they are on, if that's what they're doing, but chances are if they're not doing that, they may be having a break because of the depression. Postpartum depression. So to our moms, major depressive episode within 1 month after your delivery. So month after your delivery, if you find yourself detaching from your baby, you are not bonding like you should, you're having crying episodes, any of those things, I employ that you go back to your GYN and talk to them, OB/GYN, and talk to them about your symptoms. And what will happen next is that they will give you an assessment or refer you to someone from the mental health profession so you can get an assessment to find out if you are truly going through postpartum depression. Please make sure you're doing that. Those of you that are following me today that are moms and just had a baby, please make sure you do so. Seasonal affective disorder. So what also known as, notice that the acronym is SAD. It's the onset of depressive illness during the winter months. So during the winter months, you begin to start becoming depressed because now winter is coming in. So you notice that it's starting to get darker. It's not as much sunlight. So these people that are going through this form of seasonal affective disorder are experiencing the fact that the winter months are in and summer is out. So what's up next? What causes depression? So let's look at genetics. So genetics, family history of depression. So as a therapist, I will ask you during our meeting, if you happen to tell me, I'm depressed. So I'm going to ask you, well, what side of your family, or is it both sides of your family, who has possibly depression? That helps me to help you so you can understand that depression didn't come out of nowhere, that is possibly in your genes. Biochemical, serotonin. So, what is serotonin? So, serotonin is found in our brain, but its job is to regulate anxiety, happiness, and mood. When this is affected, it is important when a doctor can help rebalance that. And how do they do that? They will possibly prescribe you medication to help you balance again, where now your serotonin should be doing what it's supposed to do, regulating anxiety, happiness, and your mood. Environmental, childhood trauma, long-term stress relationships, relationship strifes, and psychological factors, simply loss of job or loss of a loved one. So this can affect you psychologically. So next up, we'll be talking about the symptoms of depression. So the symptoms of depression is presently sad, anxious, or empty mood. Sleep too much or too little. You're not eating like you should, so therefore your weight is fluctuating, going up or down. Loss of pleasure of interest in things. Restlessness, irritability. Persistent physical symptoms that do not respond to treatment, such as chronic pain. Difficulty concentrating, remembering, and making decisions. So if you have a feeling of also being fatigued or loss of energy, feeling guilty, hopeless, or worthless, and then thoughts of suicide. If you experience 5 or more symptoms for 2 weeks or more, you could have major depression. Again, if you're experiencing 5 or more symptoms, seek medical or mental health profession, because at this point you need to be evaluated to see if you have major depression. Gender differences. Yes, there are gender differences. So let's understand that a little bit more. So depression is more common among women than men. So when you're looking at the breakdown, depression affects women biologically, life cycle, hormonal, psychological factors unique to women could be a possible link to women's higher depression rate. For men are more likely to acknowledge having fatigue, irritation, loss of interest in once pleasurable activities, and sleep disturbances. Women are more likely to admit to feeling sadness, worthlessness, and excessive guilt. So, those are your differences when it comes to gender and depression. Next up is misdiagnosis of depression in Black and Brown Americans. Now, we have to pay attention to this part here, how most of us can be misdiagnosed. Factors that contribute to fewer African American and other people of color being misdiagnosed include a mistrust of mental health professionals, cultural barriers, which includes language, relationship. If your relationship is not good with your doctor, then that could be a barrier also where that person can misdiagnose you. They may just say, oh, there's nothing wrong with you. You can, go home. You're good, because you possibly don't have a relationship with your physician where they can take the time, listen to what you're trying to say about what symptoms you're going through. Reliance on support of family and religious community rather than mental health professionals. Look, I'm all for family and religious support, but remember, you can have that in conjunction. If you're relying on one thing, then you'll be missing things for yourself. You'll be missing the diagnosis of being depressed because you're only relying on the fact that you have support from your family and the religious community. If you combine all three, then your success of health would look a lot different. masking of depressive symptoms by other medical conditions, somatic complaints, substance abuse, and other psychiatric illnesses. So the masking. So one thing can mimic the other. For example, if your depression is mimicking another behavior, then it can be missed. So being sad, a person can say, well, you might be sad because you're just using, I noticed that you drink more alcohol. So I noticed that you're sad about that might be contributing to your sadness. Not necessarily the case. It could be genetics. So if this masking appears to happen and you're noticing it, reveal that mask, take it off, and show people what's going on, especially your mental health personnel and medical professionals. Socioeconomic factors such as limited access to medical care. So those are the ways of having the Black and Brown community misdiagnosed of depression. So as we move right along, the attitudes and depression. So let's focus on this a little bit more, because a lot of the times we have our own way of thinking about the mental health community and how we feel about it. So according to the National Mental Health Association survey on attitudes and beliefs about depression, about 63% of African American and Brown Americans believe that depression is a person weakness. No, the weakness would be if you don't get help. That's your weakness, not the weakness that the person has it. And letting people know is the fact that you are aware of it and you're going to get the help. 31% of African Americans said they believe depression is a health problem. So it's believed, but only 31%. Close to 30% of African Americans said that they would handle it, which means depression, themselves. So I'm wondering how. How would you handle your depression yourself? Ask yourself that. How would I handle it myself without any mental health intervention? 20% said that they would get help from family and friends. Only 1 in 4 African American and Brown Americans recognize that change in their eating habits, sleeping patterns are signs of depression. And only 16% recognize irritability as a sign. 16%. 1/3 of African Americans and Brown Americans said that they would take medication for depression. Only 1/3. Almost 2/3 of respondents said that they believe prayer and faith alone will successfully treat depression almost all the time or some of the time. Again, I want to go back to that. There's nothing wrong with believing in a higher power, but can we kind of combine the two together so you can actually work through your depression? And because there's nothing wrong with prayer, but utilize both to your ability. So as we move along, we want to talk about now suicide in the African American and Brown American community. So let's talk about that. What we misunderstood about suicide among Black and Brown Americans. True, it's very true that white men have a higher suicide death rate. However, according to the Center for Disease Control and Prevention, also known as the CDC, highest suicide rate is among American Indian, Alaska Native people. And according to the CDC, in 2019 and 2020, the suicide rate has increased for Black Americans and other Americans of color. Although celebrities are highlighted, and they're highlighted when it's known that they have committed suicide, but every single day in the Black and Brown community, there are people taking their lives. Americans of color symptoms can be confusing also. So what do I mean by that? Members of the public, grieving family, friends and practitioners who use risk assessments through the lens of whiteness. So it can be confusing when you're looking at this person. Are they putting a mask on? Are they really having going through depression? Well, keep asking, keep observing to see what's really going on. Inaccurate ideas about suicide and suicidal thinking are repeated, which leads to unnoticed individuals that are at risk of suicide. That can simply mean, that person is joking. They probably not going to do anything to themselves, which is not a joke. No one can predict if a person is going to commit suicide, but don't take it as a joke. So as we move on, experts' point of views. So according to Rahida Walker, she's a clinical psychologist, and she found that those who know someone dies from suicide mask their pain or didn't fit the mold for common ideas about mental health crisis. Again, those that have died from suicide has masked their pain, and they don't fit the mold of someone who is going through a mental health crisis. Least depressed are the ones that bring pause to her. To be honest, they will bring pause to me as well, because if they appear to be all put together, nothing is going on, you ask them how they're doing, and possibly they could be going through depression, but they have their mask on going into the community. So you'll never know unless they actually let you know. People don't look like what they are going through. This is true. People don't. They know how to navigate through the society without anyone knowing that they are going through some form of a crisis. Among all genders, there is a steady increase of suicide attempts. But let me back up a little bit. In 2014 and 2019, suicide rates among Black people increased 30%, especially among Black girls, increased by 182% from 2001 to 2017. That's very concerning. So let's watch our girls and our young men too, but we really need to pay attention to that because that's a large number. So again, among all genders, there is a steady increase in suicide attempts. There have been 54 studies conclude suicidal thinking and behavior has become common during the pandemic, particularly among young women. Depression and anxiety is also considered to be a risk factor for suicide. Depressive signs are common among people of low income households and multiple stresses. So when you think about Black and brown people, we have complex trauma. Okay, so it's just not the pandemic, job loss, death of a loved one. It can be a multitude of things that a person is going through, especially in our community. So as we move further into this discussion, high functioning depression. What does that mean? Experiencing real pain, but the sufferer can mask their pain and hide the feelings and behaviors from others. These are people that are really good on how they function in the world. So as we move to the next fact, failure to recognize the sign of suicide. Culture, environmental influences for suicide risks. Efforts to prevent suicide in Black and brown communities remain less effective, which means that more research needs to be done, and also professionals being more culturally sensitive. Addressing suicide the same way we would address it for white counterparts. Systemic racism plays a large role in the failure of why many do not receive mental health services. And in the United States alone, mental health care is least accessible to people of color who face disproportionate amount of stress and trauma. Also, funds, insurance is not being taken. So there are a number of factors why there is failure for people recognizing the signs of suicide, and also the fact that they're not getting the help that they need. Those who die by suicide may experience traumatic experiences. Rare, a single cause of or a trigger could be identified. So it's very rare. Some people may not even exhibit what most consider visible warning signs. Some people don't. So the many masks of Black women. Black women are considered to be unbreakable. So we're not seen as one that can actually break. But here are three things consistently present among those who die from suicide. Sense that no one does not, well, the sense that you don't belong. An individual feels or believes themselves to be a burden to others. And lastly, the capacity to overcome the powerful human instinct to survive. So Black women were very good at masking. So let's talk about Miss USA. Okay, she was a recent suicide victim. So she was a high functioning person that had depression. So this is what she said. She described the following experience prior to her suicide. Experience with microaggression. What does that mean? Microaggression means that there were people that were aggressive to her, but it was in small doses. So these microaggressions, and also how she feels about herself. So there was small amount of aggression towards herself, maybe others talking about her or making her feel some type of way. Outright racism, sexism, dealing with that. Society fading interest in women over the age of 30. So society believes if you're 30 and over, you're washed out. So for her, that is something that would make her feel worthless. And then as a person that's online, she was a victim of receiving messages that was telling her to kill yourself. So if you were already thinking this way, you would only act on this act, which enhanced why she thought this way about herself. So what do we do? Reach out to those who are suffering or having trouble. Do not presume that a person is okay or would ask for help. Do not assume a person's race or age or outward demonstration of happiness means that they don't need or know someone who cares. Listen rather than hush the person. Ask about suicide. Now, asking about it does not increase his or her risk that they're going to go out and do it because you happen to bring it up. It's just you asking and also bringing awareness even to that person and even to yourself so you can be more aware of what's going on with them. So here are your references. Depression. So education.ucsb.edu, the Center for Disease and Prevention. Seek local mental health professionals if you're feeling that you are depressed. For suicide, the National Suicide Prevention Hotline, 800-273-8255, or you can text the word HOME at 741-741, call your local 911, or go to your local hospital if you're feeling like you feel depressed and you're saying to yourself, I just want to harm myself. Go. Reach out to someone and have someone go with you, but go to your local hospital. What we misunderstood about suicide among Black Americans. It's a part of the Time magazine, so check it out. And they have it was a great article again on suicide. So for this month, Women Heart Health Month. So I just want to target again African American women. Here are the risk factors for health disease in compared to our counterparts. 82% of African American women are obese or overweight. That contributes to heart disease. 46.3% have high blood pressure. That also contributes to heart disease. 36% are physically active. Only 36%. And 13.6 have diabetes. So they're dealing with compound diseases together. So what do you need to do? Go to your doctor and take care of yourself. Remember, you should be going to get a physical every single year, every year. If you feel any signs like numbness in your arm, especially the left side of your arm, the back of your neck, any type of chest pain, if you feel like your mouth is watering or anything like that, you need to seek some help, okay? Because it is very different from men for women. And women right now, African American women are the leading women that die from heart disease. So let's take care of our hearts, ladies, because we need to be here for not just for only for ourselves, but those that we love that are around us. I want to thank you so much for joining me on the couch. Have a wonderful evening. I hope to see you again in 2 weeks. And please don't forget to subscribe. Thank you. Have a good one.
Thank you for joining on the couch this evening. Be sure to follow us on Facebook and Instagram, and if you want to contact Dr. Diamond, you may reach her at candidconversations.dr.d@gmail.com. Have a great evening, and we will see you on the next show.